My next guest literally wrote the book on what's wrong with our healthcare system and how to fix it. So we're just going to fix it all now. Dr. Vivian Lee is the author of The Long Fix, Solving America's Healthcare Crisis with Strategies that Work for Everyone, which came out last year. She's also the president of health platforms at Verily. Verily uses data-driven solutions across research, care, and innovation in an attempt to improve the well-being of communities. Dr. Lee, it's great to see you. So we've been focused on a lot of different dimensions of the healthcare ecosystem and kind of making bold bets to fix it. If we were to make a bold bet along the lines of your book in fixing the system, what would be on the top of the list?
Yeah, I think one of the most wonderful to be with you. So thanks for having me. I think
Absolutely.
One of the top issues has to be that we need to make healthcare accessible to everyone in the country. We still have about 10% of Americans who have no access to healthcare, who are uninsured. And the latest data actually from the Commonwealth Fund on those who are underinsured puts the number at over 40%. So nearly half of all Americans do not have reliable access to healthcare, and that has to be one of our top goals. In order to achieve that, though, we need to really completely rethink the business model of healthcare so that it can be affordable for the country. At the current rate of spend, that's really would be a challenge for us. But we see some really positive models that have been put forward in a number of pilot projects across the country, also Medicare Advantage. So there are some new models that can make healthcare available to all and affordable for the country.
Can you go in, Dr. Lee, can you go into some of those models? Because I don't think our audience may know about them, and to kind of describe them in a way that they can understand why those models are delivering something that our overall system is not.
Sure. So one of the examples I like to talk about is Medicare Advantage. So Medicare is our nation's health plan for those who are 65 and above. And most of Medicare, the business model is paid in what we call fee-for-service healthcare. I get paid as a physician every time I do something to the patient. So I'm an MRI radiologist, so every time we do an MRI, I get paid money for doing that study. And in a fee-for-service model, we're really incentivizing the healthcare system to do more to people. The more I can do to you, the more complicated the procedure, the more money I make, the more profitable I am, whether or not it actually makes you any healthier or better. And that's really been a fundamental flaw in our current system. In Medicare Advantage, which is now about a third or almost 40% actually of all of Medicare, what happens there is the Medicare program contracts with groups of doctors and says, okay, for those thousands of patients that you're caring for, thousands of Medicare patients, we're just going to give you a fixed amount of money every year to keep those patients healthy. We're going to hold you to a high standard. You have to pay attention. You've got to meet these quality metrics to keep people healthy. But you have full discretion what you do with those dollars. Instead of being paid for every procedure, the goal is just health. And so what those doctors groups have done is really, really innovative. They spend more time with their patients. Instead of 8 to 10 minutes, it's maybe 20 or 30 minutes. They have free transportation to and from the clinic. They invest in prevention, like yoga classes, Tai Chi classes to prevent falls, to help people prevent falls. They're really focused on loneliness and isolation. So they spend a lot more time with people up front. And in return, they prevent hospitalizations. They prevent complications, trips to the emergency room, and flu-induced pneumonias, for example. And so overall, it actually saves money. Better outcomes, lower costs, and frankly, it's actually a much more satisfying experience for patients and also for the physicians. Those are the kind of models that we need to spread.
Vivian, a few years ago, I moderated a discussion. I think it was an off-the-record discussion, but I can talk about it. At Aspen Institute, Dr. Ruth Katz there of their health program ran it, and we had a person from Alphabet. I think it was Alphabet at that time. Maybe it was still Google, but it was just one of your colleagues. And we had healthcare providers, and we had people. And we were kind of looking at medical records because I'm interested in the issue of data analytics, information, AI, and how to apply new methodology. And my understanding is that you can talk about it on one level, but on another level, when you get into our healthcare records, you look at the hospital data systems, they are a horrible mess. And it's something that doesn't get often discussed, but the incumbent, almost monopolistic or oligopolistic practices of those are not designed well to align with some of the skill sets that you bring to the equation. What do we need to fix by way of our healthcare records and how they're managed, so that a company like yours and your work can actually help move some of these data analytics through this information and produce results. Is that a fair question?
It's a spot-on question, really spot-on. When the move towards digitizing medical records first started, there was just so much hope that by making all of our paper records into digital form, we could be so much more efficient with that information. We could actually also be more accurate, fewer mistakes. You know, you can't read the chicken scratch of a physician, but you can definitely read the typed out version. So we had so many hopes, but what happened in our fee-for-service model of healthcare is that the electronic health record had really, its uses were prioritized towards billing, collection, generating revenue for hospitals, fighting the insurance businesses, for example, to try to get paid more money. And so we haven't fully realized the potential of those electronic health records. We're starting to see that tide turn just a little bit. So you mentioned Alphabet. So our company, Verily, is Alphabet's purpose-built healthcare company. And we work very closely with the team at Google and Google Health. And so there has been a lot more effort now to try to make the data from those electronic health records usable, first of all, for us as doctors, but then also to really reap the potential, which is what we're doing at Verily right now, for identifying where there are potential mistakes that are about to be made. How can we prevent those mistakes? Where there are opportunities for savings, where we can figure out, you know, Mrs. Jones on the third floor in that unit, based on some of her vital signs, the computers would predict she might be getting a very, very early pneumonia. Let's intervene now, even though as physicians, we might not pick that up for another day or two. So many potential opportunities that we could have if we could have access to those data and actually really, really make the information not like a museum, but more like an actionable source of data that we could improve care. That's really our goal.
Let me just ask you, just finally, Dr. Lee, it's a fascinating discussion. You know, just 20 years ago, we were all barely still getting on the internet and trying to figure out how the internet was going to impact our daily life. And, you know, I just was, you know, remember, because I had a program at the New America Foundation ages back that looked at how it's going to impact law, how it's going to affect your life as a, you know, running a farm. I mean, it was just, we were at the front end of that. Sometimes it takes investment. Technology comes along slow, you know, and then it comes down. Now we all have smartphones. We're connected constantly. We're talking as we are today. From your sense of terms of fixing the healthcare system and looking at that balance between innovation and access, is the flow working right? I understand that new technology costs a lot and it may be more remote, but over time, is it largely getting down to where it needs to be in terms of becoming a low-cost, pervasive, more universally accessible technology? Take any technology, or is there a problem in that pipeline?
Oh, there's an enormous opportunity. I mean, one of the reasons why my whole life has been in medicine. I was the CEO of a healthcare system before I came into the technology sector. But the reason why I made this move, instead of going off to be a CEO again, was because of this enormous potential of digital health. So what you're describing, Steve, is the fact that people can actually have on their phones, on their tablets, or on their laptops, access to information about their own health, their own bodies, their physiology, whether it's their blood sugar tracings, if they're a diabetic, or their blood pressure, or whatever the measurement is, and be able to integrate that information with how they're eating, how they're sleeping, how they're exercising. We have a product like that at Verily, and there are many of these digital health solutions that are out there that have the potential to do what I call co-produce health. It's really about how we as individuals can work with our clinicians and our nurses and our pharmacists to really be engaged and empowered to have the best health outcomes. And this digital technology, yes, I agree with what you say. I think it has the opportunity to provide at scale accessible care for everyone, regardless of if you're in a rural community, if you speak a different foreign language, just whatever the access issues can be overcome, but also deeply personalized. I'm going to know my own blood sugar tracing, my own reaction. So I'll know, and the computer will help me with some artificial intelligence to say, Vivian, you really do better with soy milk, not so much with the skim milk. Or the last few times you had breakfast, we noticed that actually you did better with a couple of eggs and toast than you did with the oatmeal. If you're a diabetic, let's say, let's put that all together, or if you're trying to lose weight. So those kinds of capabilities make that technology, make me really optimistic about the technology being able to transform the way our healthcare system works and make it affordable and accessible.
I loved this conversation. Thank you so much, Dr. Vivian Lee, President of Health Platforms at Verily. And I want to tell everyone, she's the author. Go get the book, The Long Fix, Solving America's Healthcare Crisis with Strategies that Work for Everyone. Thank you so much for joining us.
Thank you.